name is Santiago González-Irizarry. I'm the Data Modernization Lead for Washington, D.C. And what I do is basically bridge teams between IT and programs so that all our data modernization initiatives go smoothly, and that includes gathering business requirements from teams so that that could be implemented into our data systems. So during our COVID response, we had a disease surveillance system that was able to generate cases in two different ways. One of them was by positive electronic test results and also by provider case reports. This was very useful for us as a way to manage one disease. But when we looked into make that sustainable and expand it to other notifiable conditions, we realized that we needed to refine our ELR and ECR case creation. We took an opportunity by participating in the data science team training and put together a team with key team members from the informatics team and from the IT team. Having a hybrid team allowed us to work together, establish those relationships, and look for solutions so that we could create what we thought would be the best way to solve this Lowing SNOMED validation. And that's how we came up with creating a user interface so that we can have near to real-time monitoring of the ELRs that are coming into our system, and we can see if any modifications need to be made so that disease investigators can go ahead and do public health interventions. By working together, we were able to address some of the challenges that included having to do some manual reporting anytime that we have a Lowing SNOMED combination that might require the epi investigator to do further manual and human interventions. This will allow us to have a more automated process and will also allow us to have dashboards. This will enable us to have a grasp of how our data is moved and transformed and finally reflect the reality of our city. We will be able to zoom in into specific neighborhoods or populations that require attention so that we can have targeted interventions. This opportunity enables us to take large volumes of data and transform it so that it will be presenting a picture of what public health interventions are necessary and prevent future threats. This also is going to establish more collaboration between our teams so that we can enhance our current systems and our future systems that will make the data more accessible to our leadership and also to the public. I think everybody will benefit from this work, beginning with how our EPIs are adjusting to new emerging conditions, monitoring and receiving electronic lab reports and electronic case reports. This will enable us to have quick public health interventions. This is very exciting for us because we will tackle many different challenges beyond the ELRs and ECRs, but we're looking at ways to look at the different common public health challenges that we may have and have quick and precise public health interventions.